Ismail Sallam. When I had read your bio, I was so impressed, and you had so much compassion and for women. And I said, oh my golly, if he empowered women, this generation, I don't know what's going to happen. But so anyway, with great pleasure, I would like to introduce His Excellency Dr. Ismail Sallam. He is the former Ministry of Health of Egypt since 1996 to 2002, and he's a professor for cardiovascular surgery, chair of AMEI Advisory Council. And by the way, we have the paper here for the speaker's bio, the agenda, so if you didn't get a chance to pick it up, please have one. Thank you so much, and I hope you enjoy this afternoon's presentation. Thank you. One more thing I forgot. I would like to recognize all the sponsors. Thank you, Zainab. Johns Hopkins University, AESA, American Egyptian, and Masri, Worldwide Health System, Egyptian American Rule of Law, Cooking and Beyond, the baklava and the basbousa. Hey, all right, okay.
I'm honored to be here today in this beautiful gathering, and also I will thank you for the beautiful food that we had. We were missing this food for a long time, and also for having the ambassador. I keep meeting the ambassador in every social gathering now and every constructive gathering, and this is a new thing which shows that diplomacy can take us somewhere in a better situation. And really I am very appreciative for Dr. Amin and Dr. Safai who invited me, and for this nice group which I am seeing. I am going to be talking about just the experience that we had in health reform, and I'm trying to put this, not because I did part of the health reform or something like that, but because I wanted to say to everybody that Egypt is still good, Egypt is still productive, and Egypt can produce a model that's very difficult to produce in other places. And before I go on with the presentation, I like to get some parts of the presentation. Did I do the wrong thing on this? Always some inspiration looking in the history, and I always call the history is back to the future, because they succeeded in many things that we're trying, and they showed a very nice presentation. When we look to the golden age of medicine, on the walls they have the treatment for many fevers. They have also surgical instruments that I am surprised that some of these instruments looks like the present instrument that we have. And nobody can forget about Ibn Sina, and if you look and see Ibn Sina doing a cesarean section, how long before it was done in the West. And also, if you look to the Alexandria Library, what is all these things, is fantastic. But my choice, or my favorite, is the Sultan Qalawun Hospital. This is really great. If you see Sultan Qalawun and the rules he put on the wall outside the hospital itself, it's saying no man or woman should be turned away, and no limit to how long they stay. No black or white is expected to pay. Travelers and locals must be treated in the same way. And on the side, there was a pharmacy, library, mosque for the Muslim, church for the Christians, or allowed to freely pray. Really, when I see you and you're talking about human rights, this is really the top of the human rights. And that's why I feel so proud that this is still the Sultan Qalawun over there, but we need to revive the Sultan Qalawun. Also, the Egyptian had been so proud with the revolution. And you can see this is not a usual thing that happened. That 1 million people stay in a square for so many weeks or so many days, and nobody can stay like this, but they have organized a system. And this is the greatness of the Egyptian, that already on the floor they had a system for food, a system for waste disposal, a system for the hospital, a system, everything was well organized. That's why they were able to stay and sustain the revolution. Even the waste disposal, you see it done in the proper way. No government, no authority. And this shows that they can develop a system even when there is no system. That's why I'm now going to my subject, which we needed to make a health strategy for it. When I came, I wanted to have a health strategy, but before coming, we have a lot of challenges. I don't want to give you all the challenges that we had, but it's enough to know that the maternal mortality rate was 174 per 100,000. That's very high. And the mortality, every one child used to die. And poor condition of the, and also there are world challenges, which is the growing gap between the rich and the poor, emerging diseases, all these things that was coming, how we can survive. I always say to have a strategy, you must first have a dream. And then you have, after you have the dream, you start to think to having a vision. And then the vision will mature to become. And that's why I always use this young child as me with a dream that when I went to Kenya and this guy died and he was so nice, volunteer only for the social and medical care, and we were in Kenya and I saw the people fighting for 4 tablets of sulfur that they get or for some sort of the most inexpensive drugs, and they are not there. And when I saw also, we were a group of professors, about 30 professors, treating them. This is the best room they had in Kenya Hospital at this time. I'm not showing the worst. I'm showing you this is the best room for which is using like an intensive care in Kenya at this time. That's where I felt the birth of the vision that I had. And the vision was simple. I wanted to eliminate from the health sector all the disparities. Disparities between the gender, the disparities socio-economic, geographical, people with a special need. This is what I wanted in my head before going into I wanted to see that I could share with anybody that I will work for that. And that's what I work in every 2 weeks, that I go on a mission in some parts of Egypt because of these disparities that I have seen. I'm also trying to say, maybe some of you will have a vision. To have a vision is not enough. But to have a vision and political will, and also you have community participation, and you have resource mobilization, you have the most important 4. There is about another 12 items that you have to get, but these are the most important, and the political will is very important. How can you get the president and the prime minister to think that health is priority? When I went in the ministry, they didn't think that health, but I looked in the speeches that the president gave, and I found in one of his speeches, he was saying health and education is a priority. So I started to say, the president had announced that, and I was a minister this time, that there is a priority for health. They say, well, I sit here, and this is in front of the parliament, and I start fighting my way to prove that we will have a health priority. I succeeded in that. And I succeeded in convincing the people, and you convince the government when you talk about security and stability. I always talk to them about health, social development as part of security and social and stability. I always say that the growing gap of the rich and the poor make it difficult now. That's why we have to think, how can we have a system? That's why we work it all the time to do this. But the most important thing that I believe that progress is inside the community, inside me, inside you, inside everybody. But how to unlock the progress? That's the story which is very important and which I lived. How to unlock the progress. This is a painting by a Spanish guy, and I always feel that in our country there is a progress in everywhere, in economy, in politics, but it just needs to be unlocked. That's what we need. And always, I love this man, John Dewey. John Dewey was a philosopher and died in 52. But he's a great guy because he gives you a recipe for unlocking the progress. And that's what I like about him. And I want to remind you also that this is a guy who started to give the education a new, better, which is the service education, to give the people skills that they can do and they can benefit from it. And this is a guy who started this business of the new education. I have also my friend Anis Mansour. He was a great supporter of mine because philosophers are not only in the United States. He was a great guy when we talked to him about unlocking the progress. We started by having a priority for prevention. We want to prevent the disease before it's happening. We want to do something so that we can catch up with the indicators in the West and in the other side of the world. And that's why we started making a strategy for the prevention, and we started to put something new, that we will work with a holistic approach. We can't work just health. We have to work health, we have to work economic, social, population, political, education. All of them has to come together. And when all of them come together, you benefit. Instead of doing one thing, you get 10 benefits for the one thing you are doing. And we made a prevention agenda. And these are pyramids that I think these are the pyramids we tried to build at this time for the prevention, health protection, health promotion, and also the services for the prevention of the of the different diseases like cancer, heart diseases. And I know today you're talking about cancer, and that's why one of the things we tried to build at this time. And we made a program, like America, when they did a program in 1980 called the American Health Program to 2010, we made also Health Egyptian, a program which is a comprehensive programmatic approach to public health. And we started with the pyramid, with this small pyramid, and we started to measure the outcome from the pyramid. And we started for the first time to have the people with a special need in 1988 to be admitted as part of the 5 years Egyptian national plans. And this is the first time these people has to be admitted. So, and then we came to the most important part of our health strategy, advancing women health. And women are the most important pillars that you can have in any strategy. And I want to show you, these are the women we were talking about. And this is the women that we wanted to advance. And in the old Egyptian walls, the painting, you can see how much they made women. It's not only they gave them a better, but also there was a great affection between man and wife, and a man and his partner, not only in the usual life, but in the afterlife. And that's how we looked upon women as something. And with these women that we have in the revolution, I must say we're going to have a second revolution, a social revolution through this way. We started to say we want health and women empowerment. And in this, we put a holistic reform, holistic reform in the fact that we wanted to improve the health of the women and the quality of the women. Just not to give them medicine or no. We wanted women to be looked upon in a way that they can the free reproductive health for everybody, a human right. We said as a human right, every woman can have a free reproductive health. Every woman also were able to have the best health, the best assets to increase their income, to increase their education, to increase also their sharing in politics. 54% of the leaders of the Ministry of Health were women at the time I was working there. And then we also started to have a family doctor approach, and we were very serious. We counted every house, every small hut, and we took a recording and a file for every house, with the animals living in, with the environment inside, with the waste disposal, with the water supply, and everything we took it seriously in about 1,000 villages. And this is a very meticulous way in delivering the service, because we know what we can do. But the beautiful thing about the Egyptian and about women that were helping is they went and they made me things which I never thought. For example, they made me a population map for the village, and they say who is against using family planning, who's with family planning, so everything is there. And also for the water supply, for the sewage, they have maps for everything. And this was invented by the young doctors that we have in the villages. The other thing that we have 11 million persons not accessible when I started in the ministry. And I managed in the first 3 months to buy 460 clinics, mobile clinics, that move all over Egypt. Every day, 7 o'clock in the morning, they go to a place and it becomes a market. And they know, everybody knows that this is the place they can go to the clinic to have their treatment, to have whatever it is. And this was very successful in making accessibility 100% in Egypt. And this was one of the best delivery system, because we got the best driver, we got the best doctor, we got the best nurse, and we pay them per diem, not per month. So everybody wants to keep this job because it's very highly paid, and I used to get money from the donations from outside Egypt and pay them. And that's why it worked so well, that these people really was a good example of how they can perfect accessibility at this time. The reproductive health also, we have women's club. We started to make women's club, and my friends, the reporter, used to joke at me and draw the women in the village walking with a tennis racket, and they ride every day. But it was very successful. I will tell you why it was very successful. Because women cannot talk freely inside the society about their reproductive life, about their problems with their families, but they can talk in a closed place with a guidance from somebody who's guiding them. And that's what we did. And it's amazing. When we had the Minister of Health from the United States, Donna Shalala came, so they were asking to make a scenario for what. I said, no, we'll translate to her. She can ask anybody, and we'll translate to her. She asked the lady, what do you think of this women club? She told the lady, now our husband start to listen to us. Because we go back and we tell them what we have learned, and now they ask us about the problems. And it became so successful, this women's club, and we got also income generating vocational training program for the women, and we teach them, for example, how to make clothes, how to make so they go. And also we give them microcredits. At this time it used to be £100 we gave it to them. And everybody in the ministry said they wouldn't return the money. There isn't a single woman that didn't return the money in Upper Egypt. We used this program in Upper Egypt, and every woman has returned the £100 they got from us. So I must say also, this was a great program for women advancement. Gender inequality issue, I took it seriously from this time. I issued, after 6 months in the ministry, a decree prohibiting female genital mutilation. And also, I worked very hard against, also for combating violence against women. And I got the leaders from the church and the leaders from the mosques to sit down. This is the first time ever happened. When I got them, they wouldn't talk to each other. But I decided I met them in the best hotel, and let them live in the hotel, and let them talk to each other. And I have non-government organizations that supported my ideas. And we found at the end of the day, we became so friendly, and we became exactly the same regarding many issues that were controversial from the religious point of view. And that's where I feel that the best way to, at the present time, to guide Egypt, to go with Egypt, is to get all the people together all the differences, whether political, religious, whatever it is, this is the time we need all the people to know. We got accessibility to emergency care. Anybody who has an accident, he can go to any hospital, whether government or non-government. First 24 hours is free. And then after the 24 hours, we can take him to our government hospital. But we took this very seriously. We have also the National Cancer Registry, established in 1998. And Dr. Hoda Anton, I don't know if you know her, is an Egyptian in the University of California, Irvine. She's a big professor there. And she mastered this in training the staff, and we established 9 cancer centers spread all over Egypt. There was only, every patient who had cancer they used to bring him to Cairo, sleep in the hotels, waiting for a bed in the Cancer Institute. But after we did this, we have a beautiful cancer service, and I worked to get the people to go to the cancer, for example, center in Aswan. How to get a professor to live in Aswan. So I got one of the professors, and he went to Aswan. I got him an apartment there. And I got a big building from the governor with apartments, and the top floor I made it as a club for the doctors and the nurses, and the bottom floor is like a restaurant. And it worked beautifully to the extent that they didn't leave. For 6 years they didn't leave, and even after I left the ministry, this was ideal for stabilizing big consultants or well-trained people inside the community. You have to find new incentives for them. And also, now I want just to talk about, we didn't do this and we're going to say we are lovely and we're successful. No, we have measurements. Everything in these days have measurements. It's like exactly, there is nothing without, even surgery now has measurements. Not just measuring in incidents, but in making the operation, there are measurements for doing anything at the present time. That's why I'm so proud that in about 4 years' time, we were number 43 as our Egyptian health system in demonstrating the effectiveness of health hospital coverage. This was measured by the World Health Organization, and I am so happy to see that we have progressed. But if you look to the life expectancy, this is nothing. I've never seen a curve like this. Can you see the life expectancy? Every year for this program was going, added 1 year to every Egyptian. And that's why I'm saying, if you work, you get at the end results. And we have a saying that, you know, that this is not just goes down without seeing that you're collecting at the end of the day. And this is a maternal mortality rate. I told you when I came to the ministry, it was 174. But this one started in the year 2000, it was 58, but in the year 2003 it came down to 34. And that's where I feel that these are remarkable achievement. The death rate, you see how quickly. So I'm just saying that if you are doing something like even investing in a preventive program, you can at the end get something out of it. We tried to make a reform of the curative center. The most important thing in the reform, we made centers of excellence that were edited by University of Pittsburgh and University of California, Irvine. And all this have made an accessibility for tertiary care for anybody. Anybody, if he is unprivileged, without going to a social worker, he can have his operation the same week if he accepts to be done in a four-bedroom or in a room with 4 beds. If he says, I want a single bed, he loses the degree. But the ministerial degree he gets is to be done in a 4 bed. So the hotel, this year marks the rich from the poor. For the rich will never go to a single. And that's why they will never go to a 4 bedroom. And that's why I say that the curative service is not very difficult. We were spending only on this point 7% of the budget. I'm just going to tell you, these are my heroes. These are the people working with me, the people who are really believe in what we are doing, that the sensitive was very low, but they worked so hard to make this achievement we see in the health indicators and all these things. Still, we have a more vision for young people like you to become a leader and to get it. Well, thank you very much.